Hello again. Thank you for tuning into Extra Dialogues. I am Susan Sindani, and once again I'm here building a case for integrating PHED. I've been joined by PHED leaders. I'm really excited that Kenya and Uganda is represented in this conversation. So what inspired you, Esther?
Okay, so maybe I'll start introducing a little bit about myself. So my background is community health and development, and I'm currently pursuing a master's degree in public health. So by default, you know that my interest is in health.
Yeah.
So I have previously worked in the sexual reproductive health space. I have worked in mental health space and just general space. I've done some programs on WASH, HIV, TB, and malaria.
Okay.
So that has been my space for long. But recently climate change is coming in, and as an individual, I have been trying to get knowledge on how it's affecting health. So when I went to the African Climate Summit, I happened to go to the booth that the MOH was presenting, and I had a lot of questions to ask. So I went to research online, but I couldn't get the complete package information.
Right.
So when this opportunity presented itself, I was like, wow, this is the
know,
right
just
space.
Perfect.
Exactly.
I come from a public health background in a country where everything works in silos.
Right.
But right now we are living in a time whereby we all know the effects of climate change. Uganda is one of the fastest growing countries population-wise in the world. So I needed a program that integrated the aspect of population, the health the environment, and all that which could lead to development. And that's PHED spoke to all of those aspects, and that's why I entered the program.
I'm a public health specialist as well. My desire stemmed from the kind of work that I do as well. We normally have youth engagements in our communities in Uganda where young people talk about issues that are most pertinent to them. And recently, since the year 2021, climate change and how it interferes or interfaces with the different things that they do, not just in their livelihoods, but also in regards to their health, their education, was coming up so much in the spaces where we were having these conversations. So as a public health specialist as well, I got intrigued to understand the interconnectedness that health has within the environment, and even the development that can come out of having these two concepts merged together.
In my case, I have been aspiring to create change, to bring change to the society, and a transformative change that is carrying all the aspects in a growing country economy. So I was looking for something that I can bring together, because I've been in the field in activism towards climate change, but at some point I get stuck because I major only on one thing. So I saw there is interest in joining the PHED program because it integrates the issues of climate change, everything, environment, population, anything that is needed to any development of a country.
Integration of PHED concepts brings a synergistic effect, a much greater impact than what you would get from having programs that are specifically designed to address one particular issue.
What really stood out for me is systematic thinking and looking at the problem holistically.
Yeah.
For example, if you're looking to have an intervention that is going to help a woman, you kind of have to incorporate the man, you have to incorporate the community around her, you have to incorporate the children, the religious leaders, the whole community around her, and that is what PHED is all about.
What is the other value that integrating FP or reproductive health add to PHED interventions?
The issues of family planning, sexual reproductive health contributes much and affecting almost every sector. That's if you talk of population, if you talk of environment, if you talk of development in general.
I can give an example. We went to the Masai Mara community and we had this male involvement session. It was a session on family planning, a topic that in most cases we would think it affects the women. Why are we targeting the men? But PHED is unique in such a way that it realizes that even in such complex environments, you kind of have to target the man, because in most cases they hold the decisions when it comes to some of these things.
The connection between climate change and population growth.
So we know that when there is a rapid increase in population, it causes a strain on the population resources.
Yes.
And when the resources are strained, it brings about other effects,
Right.
which includes rise of new diseases or other health condition, poor sanitation and hygiene.
Right.
Strain on those resources will lead to people cutting down trees
Yes,
or
to earn a living,
to build
to
and
build houses,
to build
facilities,
houses.
yes.
Yes, and other facilities. And that means that there's loss of biodiversity,
Yes.
the trees, the animals, and all that. And when that happens, it also causes an impact on health.
Yes.
And that it majorly impacts women and children.
Yes.
Of course, poor family planning leads to maybe an overpopulation in a place that leads to underdevelopment due to poverty, limited resources. People scramble to meet their needs with limited resources, and also it affects the general ecosystem of the area. That is the resources, like if the area is a remote place, they don't have renewable energy or sources of energy, they depend on fuel. That means they will clear forests to degrade the environment, and also if they're depending on wildlife in terms of food, they will poach the animals around the surrounding to extinction.
The most critical one that we usually talk about in health spaces is the demographic dividend. I think it's very important that as young leaders and also who are active in civil society spaces, we enable people to appreciate this concept, because harnessing the demographic dividend looks at the gains that a community or a country gets from having, fewer dependents and individuals who the community or the country can be able to look after, support sustainably. So the demographic dividend focuses on the productivity of the country, productivity of the citizens and the population at large, as opposed to having individuals who are really dependent, struggling to traverse the economic challenges, the unemployment. So I think that's a critical concept that is, family planning is central to attaining that demographic dividend.
Just addition on that demographic dividend, I've just recently learned about how like South Africa had a really large demographic dividend, and they didn't plan for it, so it went into a loss. So I've been really thinking about now Kenya, how can we harness that demographic dividend, because right now the young people are the majority. And there will be a time when you have a large, will be the working generation. So I've been asking myself, how is the government prepared to harness this? Are the CSOs knowing things about this? So I've come to realize that if all the development partners will be having this integration aspect of programming, they will actually know what is going to happen. They will be planning for it.
We can also balance the pyramid, because when you look at Kenya, the majority of people that have the energy to go out and contribute to the development of the nation are actually young people, are the majority. But the question you've raised is, are we investing in this potential? Because they could really contribute to the demographic dividend.
I think family planning is a critical role, not to reduce the population as most would have believed, but rather to empower individuals to make choices that can help each and everyone in their families to have better access to health, education, and the social services in general. My initial journey, understanding how population and demographics play a key role in development. So the interconnectedness, or the role of family planning and population, is something that wasn't abstract to me. I know that in many of our communities, say Uganda, for example, where 70% of the population is youthful, we know that even development challenges, young people face the greatest burden of these challenges. So bringing the concept of family planning and trying to address some of these sexual and reproductive health issues, the unmet need for contraception, enables young people to plan for their futures, live in communities where they have sustainable homes, families that can better plan for the number of children that they have, and even have a choice in the kind of choices or steps that they choose to take regarding their health.
For example, if you do have 10 children at this very moment, we all know how bad the economy is. In most cases, you find someone is not able to take care of the 10 children from medically affecting their health. Maybe they're not able to take care of tuition, school fees for all the 10 children. So this leads to things like environmental degradation. They are trying to cut the small piece of land they have, just that so it can fit agriculture, a house, and all those other things that affects the environment. Given the limited resources that I have mentioned from the start, we see that these people are really not destined for a developed future. So in one way or another, it affects development. So that's the whole leakage of population health, environment, and development.
So I'm taking it in this perspective. What if we have like people or the population is empowered to plan for their family?
Exactly.
If you plan for your family, you have a population that you can be able to manage.
Right.
The government can be able to allocate
Enough resources.
and even plan for those resources.
Exactly.
You will have facilities that are enough for the population at hand, and people will have quality life, quality education, and of course the nation will be quality.
I will give an example of this aspect. The project we went to see still in the Masai Mara. These people had an aspect of population whereby they are giving out information on sexual reproductive health and family planning to the women who needed it.
Yes.
But they also had a school project whereby they were targeting the younger generation in school, teaching them to plant trees, teaching them how to plant trees even in their homes, and actually teaching the women in their homes to plant trees to get a livelihood through it.
Yeah.
So we are reducing the population. These people are getting a livelihood, they are getting help. They are selling these trees, they are getting some money from it, they are saving the environment, and all of this leads to development. So it was a very beautiful integration.
You mentioned about integration, and you come from different countries, from different spaces. How do you think people back in your organizations are going to look at this concept, given how they have been used to doing things like separately in silos?
I work in a climate space which I do advocacy on adaptation and mitigation. Most of the time we go to address an issues of can you increase the tree cover in this area?
Right.
The residents in the area do not have food. Actually, where will you get energy to carry out such an activity?
Yeah.
Or if they need to plant trees, let's say the ASO regions, they don't have medical facilities, they have poor health.
Right.
So when you go in a silo individual or in a silo perspective and going in terms of climate, what about the other aspects that bring low the issues of development in the area?
Right.
If you continue the climate space, what about the health? Integrating them into one thing, it will ease the reach to people and is convincing that this issue should be solved this way. And if you have these other issues, we have also an alternative for it. We need to bring these things together so that we can work as a team and contribute to aggressive development. Development has been dragged behind in most developing countries because of being in silo format or context.
Yeah.
But if we integrate these things together and bring them on practice, I think we can contribute to a much development within a short period.
Personally, I have come to know this concept here during this training. So I'm really empowered to go out and, create awareness and share what I've learned. Like in my organization, we do all this programming. We do have programs in health, we have programs in environment and climate change, we have programs in development programs, and we also have, we don't have programs in population, but we do programs in this different
You implement like differently?
Separately, very separately. Like the people who are doing health do their own things. Those who are doing environmental conservation do their own things. So this is an opportunity, there is a high opportunity to integrate this program. Yes. And I'm seeing as from my point of view that it will, lessen the costs, the resources, cause and bring about efficiency, because you will all be working on these four different programs, but still meeting your goals, meeting your objectives, and making the impact that you really wanted.
Basically, I anticipate the first reaction to first be shock.
Right.
Obviously, this is a very new concept.
Yes.
Previously for us we were public health and that is it, and now I'm telling them, by the way, we need environment into it if we are really to achieve development. So I expect a little bit of shock, maybe a resistance here and there, but we are privileged enough to have learned a few advocacy skills here and there, smart advocacy, how to be an authentic leader when mentioning some of these things out. So I anticipate a few resistances, but that's not something that's going to stop me. We have to advocate for the cause we believe in.
Yeah.
And I believe by the end of it all will work out. And we shall have the full integration like we have it in our visions.
Amen.
Yeah.
I think similarly, just like many of our organizations, not just in Uganda alone,
Yes.
but in Africa generally,
Exactly.
I think many of our countries have adopted the idea that you have to focus on one central thing, maximize the gains, and then move on to the next problem. Right now, with as we look at the concept or the approach of population health, environment, and development, bringing these core concepts together and merging them to get more additive gains, to bring more stakeholders on board, because ultimately these issues affect us. Not just we don't suffer from health issues independently.
We suffer from
Yeah.
them,
We
like,
get-
together collectively.
Yes.
We know we
Exactly.
feel the impact of many of these challenges all together wholesomely.
Yeah.
So I think it's a very good call to action for us, the young people, especially in the organizations where we work.
Yes.
As part of my role as a young board director is to amplify the voices of Ugandan youth to various stakeholders on issues that are most pertinent to them. And when I was looking at some of our impact priority areas, we do work in climate, environment, and all this has not been integrated together to see how best can we leverage new networks, new development partners who can bring the aspirations of the young people even much more of a reality to them, as opposed to
Exactly.
focusing on one thing.
Why integrate gender and youth, Remy?
Oh my God.
In PHE interventions.
I don't know where to start. You see, the burden of development issues is so severe on young people and men and women,
Yes.
because gender is a concept for both.
Yes.
I think that oftentimes we have programs for women, for men, for young people. We have them oftentimes as beneficiaries of these programs.
Exactly.
But PHED looks at gender and youth as an opportunity to have these different categories of people, not just as beneficiaries, but as partners, innovators.
Yes, stakeholders,
Yeah.
funders.
It looks at them wholesomely,
Yeah.
because also, as we know right now, the issues of gender, for example, young women and girls globally, 12 million being married off at an early age
Yeah,
every year.
child marriages,
Yeah. In Uganda alone, the number of adolescents who are suffering from HIV, the rates are much higher in girls as opposed to boys. So issues of gender are very critical. They are very important, and we continue to struggle and try to amplify their voices in the spaces where they don't have access to decision makers, where they don't have access to influence policies,
Yes.
or even basically just have access to information.
Right.
In the work that I do, I've engaged more than 1,000 young girls in almost 15 districts in Uganda.
Wow, that's really
But you'll be so
commendable.
surprised to know that issues of health, issues of the environment are a bit abstract to these young people.
Yeah.
Sexual and reproductive health is one of the major and the leading causes of school dropouts in Uganda. So gender and youth integration are very key in population health, environment, and development, because they are the future. And we build resilience. Imagine creating a generation of young, resilient women and men who are ready to act on the things that they feel are most pertinent to them. So I think it's a core concept that we should carry on as leaders.
Just to
Gender,
add on
okay.
her issue
Okay.
on gender youth perspective in relation to PHED, like the youths, for example, they are the people with energy. They
Yes,
can act
that's
very
right.
quick
Yes.
to issues that are affecting the world. Let's say if it's issue pertaining climate, issue pertaining health, they can take several actions in a few days or years. The integration between PHED, youth, and gender, there are very key roles in this, and also to a point that we are also chasing the total gender role in development, in representation.
Yes.
Yeah.
It's very important. The first is the inclusivity it comes with it. I'll give an example in Uganda. Very many decisions that are made in Uganda for the youth, you find there is no youth in the room. So in most cases, the decision doesn't even target the person that they anticipated it for.
Right.
It's not relatable for the youth. We are one of the youngest countries in the world, Uganda, so we have a lot of youth. It's just the right thing to do if you include them in the decision making, because you'll have an intervention that they actually works for them, that actually targets them, and that they actually feel part of it. If the youth feel part of the decision making, it makes using the intervention more better and effective.
Right.
So that is why I believe it is important for this.
The integration of gender and youth.
Yeah.
African leaders always say the future is the youth.
Yep.
I heard a leader saying for them they are already aged and they'll be going.
so-
We are the one going to face the consequences
Yes.
of climate
Yeah,
change.
exactly.
And as you have seen from the available data is that women and girls are largely affected by the effects of climate change.
Right. Yes.
So we can't leave them aside in population health, environment and development conversations.
Yes.
So all of them have to come together and be at the decision making table and decide the future that they want. Exactly.
The benefits of equity
Yes.
when it comes to resources.
Uh-huh.
Equity deals with fairness,
Right.
whereby it's not about everyone having the same thing, but who needs the resource more.
Right.
So yes, including these people when it comes to PHED, you get to actually understand, you map out that actually, despite the fact that men, women, children, youth, everyone suffers, there is this class of people that actually needs a specific attention.
Right.
And at the end of the day, we shall get the best solution to such if we use this method whereby everyone is included,
Yes.
seen and heard.
If you start the foundation from the bottom, that you get a clear finishing line.
Yes, definitely.
Let's not take this perspective like we should introduce it at the working level. Let's take it to learning institutions, and also the youths are mostly in the learning institution, universities, high schools. They get to be used to this concept. They grow up knowing that as we grow up, all things are important. They need to be dealt at the same angle.
Yeah. Holistically.
Yeah, holistically.
So the interesting thing is that having PHED has a much greater benefit. It accelerates development of our communities much faster. We usually learn or hear that 1 + 1 = 2, but from this program we've understood that 1 + 1 actually is equal to 3, because it's the bigger picture. It's what we all aspire for.
This concept works in such a way that previously,
Yeah.
when they give you a fund, for example, they've given you a fund for mental health. You
Yes.
receive the fund, you're happy about it, go and implement mental health, and that is all.
That is
so
it.
the 1 + 1 they've given you is equal to 2, the mental health.
Yeah.
But in PHED, we are looking at you receiving a fund for family planning,
Yes.
but dropping in the environmental conservation aspects in it, show actually integrating environment in it. This will lead to good health services, and
Right.
it will eventually lead to development. So the funding you receive, for example, for one family planning campaign is actually helping you get like 3 or 4 benefits out of it.
Exactly,
You're saving the
exactly.
environment, you have better health, and there is development. And then you reduce the population.
And 1 + 1 is.
4 in this context, yeah.
What are some of the key messages that stakeholders need to understand about PHED integration?
My most important message for young people like myself, but also policymakers and other activists in the civil society space, is that population health, environment and development integration is the future. It is the way to go.
Yes.
It is a mandate for each and every one of us. It is a call to action, to create that synergy, to strengthen our relationships, to mobilize more young people into this movement, to be able to, push the message of having countries or communities where young people, where different communities, including other vulnerable groups, marginalized groups, are brought into this discussion where they can contribute positively to approaches that can make their communities better. I think population health and environment integration is something that complements the efforts of not just young people, but also governments.
Yes.
Exactly.
It's also critical to note that young people have so much energy in them. We are innovative, we are passionate, and we really drive the things that we want to see in our lives. Yeah, I think it's a whole
Untapped potential.
yeah.
Yeah,
It's like
opportunity.
I was going to use the word of a piñata. something that has unlimited amount of, benefits. If we
Yeah.
have more countries, more communities, have youth, have women and men, have the most marginalized people as part of this approach. I think, yeah.
If we need to have a quick developing world, we need to restructure the ministries or the government
Yes.
in terms of allocation of funds in development issues. We incorporate the integration of PHED into our structures so that we can move at the same pace. Then,
Right.
depending on one side, like if it's the Ministry of Health, it is depending on their own financial issues. And if they will not be involved in the environment sector, they will not contribute. So
Exactly.
if we incorporate them, like if you're in the Ministry of Health, if you need your help in climate in a certain region, you can just chip in and help. That will contribute to a quicker development and a faster growing world.
In my part, after all that is being said and done, basically I would request our leaders to be as open-minded as they can.
Oh, yes.
This is a very new concept, and we are used to working in silos. This is not something we always work with, integration. But if we are as open-minded as we can be, I believe this can all be achievable.
For me, it was really interesting to know that in Kenya we had a PHE strategy.
Yeah.
So I'm just imagining if all the counties adopted and implemented the strategy.
Yeah.
What impact would it make? Now, this is from the government point
Yeah.
of view.
Yes.
If every county implemented the PHED strategy in their counties,
Yes.
this would also mean that the development partners, the CSOs, will also be able to adopt it,
Exactly.
That's true.
Yeah.
and it will be
That's true.
integrated in all our programming. So for me, it's a call that for this new coming PHED strategy, that it should be advocated for all counties to adopt and implement it.
Yeah.
The budget lines should be streamlined to capture.
PHED integration.
Yes,
Yes.
to capture the PHED integration. And the civil society organizations need to take action now
Right.
and start implementing it in their programming.
I'm actually really happy that we have the resources to listen from some of the best practices. What were the successes of the PHE strategy in
Across the
Kenya?
world.
What were the successes? There's a lot to learn
Yeah.
in the work that we do, in the efforts that our governments push across. So I'm really excited for the future that we have.
Yeah, I'm really excited because we are going to be moving together and I can't wait to see the impact. Now, wrapping up for every one of you, I'll give you a chance to tell us maybe what is the actions that you want to engage in coming from this training back to your own spaces, and then you can say your final remarks and then you can wrap this up.
Okay, thank you. It has been a really wonderful conversation. For me,
Yeah.
generally I do advocacy.
Yes.
I'm a trainer. So I was, in my organization, because I said we work in silos, I would really like for my organization to start integrating the PHED strategy. So that is internal advocacy to my
Yes.
organization to take that up. And then I'd like also, because my organization is a youth-led organization, I also like to see other youth-led organizations that we can collaborate with, pick up this. I have the information already, so it's creating awareness and also capacity strengthening them to be able to take up this and maybe put them in their strategies. I know most organizations are doing their strategies at this period.
Yeah,
so
this period, yeah.
yes, so it's something that I can bring it up to them, capacity strengthen them, and help them put that in their strategy and implement.
Wow,
Yes.
that's awesome.
It's not that difficult or technical that cannot be understood and needs learning and so on. It's an issue of advocacy too. So if we incorporated it, can ease our work and
Yes.
also how we come across the challenges we have been coming across about we are hungry, we can't plant trees.
Yeah.
So what do we do? So we tell them we have come with the Ministry of Health. They can deal with you in terms of health issues. We have come with the Ministry of Issues Agriculture.
Yes.
They can help in how to plan agricultural practices
Yeah.
and so on. Yeah.
Thank you.
Yeah. So in my work, I'm a programs officer in my organization, and I manage spaces where health programs are reaching so many young people throughout the country, and many of these programs have been on health. But moving forward, I think I'm really excited because I already have the access to the young people.
Yes.
I already design many of the materials that we use in these programs. So it's going to be very easy for me to help them appreciate how they can contribute positively to the environment and, make healthier choices in their lives that can empower them to, be more productive, not just right from school, but even in their communities. But I'm also privileged to be part of a unique space on our governance structure for an organization where I hope to design a whole board paper that is going to present the opportunities, the gaps, the challenges of not having PHED as part of the organizational structure. So I'm really excited about that, and it's something that I hope to mirror for other young people who hope to learn from this program, what they hope to anticipate. So I'm going to champion PHED in my organization and in all the spaces that I have access to at the moment.
For me, in my public health space, currently I'm in mental health, and PHED actually one of the lectures in one of the lectures that we had, someone spoke the exact issue that we have been facing. Us in the mental health space, we actually do offer therapy to the women who need it. But in most cases, someone tells you, my problem is hunger.
Yeah.
What will the therapy really do?
Exactly.
And PHED actually provided solutions to that, whereby we can actually talk about the population. We can bring in the concept of health that you're already doing, but bring in environment, but in such a way that they can actually earn money through it, which will lead to development. So my take home is, I'm actually going to take all the lessons we have learned from here, the advantages of this integration, and explain to my organization how we don't have to do mental health alone. We can actually use the resources that we already have at this very moment, but just to add in a little concepts here and there, and say that we solve a woman's problem or a man's problem holistically.
Systems thinking.
Yep.
Right, thank you so
scaling
much.
up.
And scaling up. That was a really, really powerful conversation, and you've heard from us one voice. We believe and advocate that PHED integration is the way to go.